A carer is somebody who provides care for individuals who are vulnerable in some form. They might be the elderly, they might have dementia, or they might be young and have autism or learning difficulties.
See, this falls right in my alley because working in the healthcare industry is currently my day job, and there's no worse place to be working right now outside the service industry. So let's hear her experience on the subject matter.
I was pretty much thrown in the deep end training-wise. I came across a lady's room and the lady was covered in her own excrement, and so was the room. And it was evident that another carer had already been in there and seen the state that she was in. And they'd basically taken off their gloves, put them on the floor and walked away from her and hadn't called for help. It was an awful experience because it showed a level of negligence that is just not acceptable. I did report this to another senior staff member, but there was no follow-up.
As a person working in the healthcare industry, you learn to understand the worst line of dialogue ever said by your superiors. And that worst line of dialogue is called team player. Team player stands for do not upstage none of us unless we want you to. Then we'll take credit for everything. Teamwork means if one of us who speaks for the rest of us says one thing, we all have to agree. It means one head for the whole flock. It means if we find one patient undeserving of care, you help them. You have to do it alone. And since you go against us, you're a mark card. We no longer fucks with you.
During my time in care, I met some really highly motivated people who were absolutely incredible at their jobs. But these people were few and far between.
That's correct. But they are a lot more considered disposable than the worst of caretakers. More on that later.
I unfortunately did witness a number of cases of abuse. During my first instance of care, where an elderly woman got sexually assaulted by an agency worker, a lot of the residents that I met were lovely individuals who each had their individual personal struggles. But we did experience assaults. I have been bitten, I have been dragged, I have been pinned down to a bed, I have been kicked, I have had a young person try to strangle me before. Complaints and concerns were not taken seriously.
The togetherness in the healthcare community actually is just as strong as if you were working in Hollywood. If you know, you know. I've already spoken about team player. Now let's talk about your higher up favorite term of endearment. And that doo-doo child is called family. Plot twist. There is no family. You can get fired a lot faster than it took for you to get hired. And that doesn't even cover what I meant when I said we all disposable in this business, especially if you do your job and they don't like you.
Care homes and residential homes are often majorly understaffed. When you are understaffed, it puts an enormous strain on the individuals who are left to care. One of my homes, for example, there were 3 of us for 22 individuals, most of whom had dementia, and we had a broken down lift. It was often hard to give adequate care when you had so little time. Family members are often mostly unaware of how understaffed residential facilities are. One of the client's grandparents found out how much inadequate care was going on around her grandson, and she really wanted to take her grandson home to find a different facility for him, but she was basically forced to keep him in this particular facility because she was told that if she took him out of it, that she'd lose all funding for him from the council.
In my opinion, nothing that involves people's health and well-being should have the word business associated to it. That's where everything went wrong here. It's a matter of money. Money rules the whole concept. And sadly, the people who you think are getting paid for keeping the business afloat are often the most underpaid and understaffed. As a family member, there's a saying going out lately: treat your children wisely or you end up in a home. I can't say members of families don't know this, but what I can say is there's clearly a difference in family members who are able to keep their loved ones away from homes for their elderly to the ones that keep them at home with them or get someone to take care of them in their own house.
Management can be particularly cruel by picking them out and using them as an example. Residents who are elderly may call them unpleasant slurs, I know that a lot of individuals ended up taking antidepressants, having worked in care, because we felt like we had failed at our jobs and that we couldn't care for these individuals properly because of the lack of staff, the lack of payment. I think the care industry is definitely exploitative towards staff and vulnerable people. I think that vulnerable people are often seen as money signs by management rather than the individuals they actually are. If I had to have a loved one put in care, I would find it extremely hard, especially to trust other staff members. And that makes me feel awful because I know that there are really lovely people out there.
And that's where this comes full circle of an industry that is all damage and no issue solving, where you are asked to care for people that are not even seen as people by your own superiors. It's your typical hurt people, except the people who are hurt to hurt here are the staff and the patients. In my opinion, or in my experience, I've had it worse during COVID, where I had to work in homes that sometimes had no electricity, whole family had COVID and refused to wear a mask, and at one point in time, knives were pulled, cops were involved, and I was the one who was let go by my superiors out of fear that I would sing like Beyonce. Stuff like this have become a villain arc. The why most healthcare professionals don't actually care anymore. Just here to get the bag. I suggest y'all watch the full video. It tells its own story compared to what I chose to align together so that I could talk about it. Don't worry, I'll also link it in the description for you to make it easy for you. Anyway, do what you gotta do and see y'all when I see y'all.